Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to go over glute bridges, a very common exercise after knee replacement surgery, how to do it correctly, and what are some variations that you can start to incorporate in your rehab and recovery. Before I jump into that, be sure to hit that subscribe button if you don't already, so you can catch all of our latest videos related to knee replacement surgery, rehab and recovery, frequently asked questions, and much more. So the bridging exercise, very common exercise, the goals of this exercise is really to start to activate and contract and strengthen the muscles around your hips, particularly your glutes, your glute maximus, your glute medius, your glute minimus muscles. It also can be a relatively good exercise for starting to activate some of your core muscles as well, and just working on general mobility through the legs. So to start this exercise, you're going to be laying on your back on a hard surface. Can be really beneficial. I notice when people try to do it on a bed, the bed is really soft and they kind of push into it and lose their stability and can't get up as high. But if that's all you have, the bed will work. But if you have a firm surface, I'm on the floor. Obviously, it might be a little difficult for you to get on the floor after surgery. You could use a therapy table, obviously, if you're in therapy. But if you have a firm surface, that can be beneficial. But any type of flat surface, you're going to lay down with your feet, with your knees bent up so your feet are flat on the surface, and you're going to be laying down on your back. Now, what I always encourage people before doing the bridging movement is you want to take the small of your back, this lower part of your back, and you want to push it down into the surface that you're on. So you want to push your low back and flatten it against the surface. And what that does is it's actually going to provide a slight tilt or a posterior pelvic tilt of your pelvis and of your pelvic bone. And that posterior tilt is going to allow you now, as you keep that position, to get the majority of the motion coming from your glute and your butt muscles rather than arching and activating low back muscles that we don't want to focus on with this movement. So you're going to get down in the position. You're going to push that low back down into the table, down into the surface, causing that little bit of a posterior pelvic tilt. You want to keep that position, keep your core muscles activated, and then you're just going to push straight up through your legs and come down nice and slow. Push up, down nice and slow. A lot of times people early on, they might have difficulty, and you might notice that you're not able to get up as high with the motion as I did. There's a lot of different reasons why that may be, but part of it is you really want to focus on the motion is coming through, pushing through your legs, squeezing your butt muscles, and activating those muscles. It's not coming through trying to arch your low back or trying to push your legs forward or push your legs back. It's really trying to push straight up through your legs like this and then back down. Straight up and then back down. Now from here, there's all sorts of variations we can do with the bridging exercise. So the most common one probably is eventually going to one leg. Obviously, going to one leg, that leg is doing double the effort, increasing the resistance with the movement. A couple ways you can do it is you can take the one leg and hold it up like this. Another option, which I find a little easier if you have the mobility and the flexibility, is just to cross the leg over the opposite one, and you can go up and down like this. You can also hug the leg to your knee. This one is a little difficult for me, but an option as well. So one leg is a good option. You can also do holds or isometrics, so going up into that bridge position and now trying to hold that position for a prolonged period of time. Maybe it's 10 seconds, maybe it's 30 seconds, maybe it's a minute, and then slowly bringing it back down. So isometric contractions or holds. One of my favorite ones is called walkouts. So you do the bridge and you actually start to walk your feet out and then walk your feet back in. This one's really good for your hamstring muscles and the strength in your hamstrings as well. And then down. From there, you can really start to incorporate doing the bridging on different surfaces. So probably the most common one is with a physio ball or a therapy ball, and having your legs up on the therapy ball and doing a bridge from that position. Just adding some instability, making you have to activate your core muscles a little bit more engagement of your abdominals. So bridging, really common, really great exercise. Really you want to start to use this exercise to build up that strength so you can progress to more standing weight-bearing type exercises. So body weight squats, sit to stands, deadlifts. Don't be afraid when you hear the word deadlifts. There's lots of ways to modify a deadlift and make it so it's appropriate for your level of physical activity and exercise experience. And any type of weight-bearing activities. It's really starting to build that strength in your hip muscles, which of course is going to play an integral role in the stability and alignment of your knee and your legs with all motions. Thank you very much for watching, everyone. I hope you found this video insightful and instructional. Please leave your comments, your questions below, and I'll be sure to get back to you. And thank you for watching.